بسم الله الرحمن الرحيم. Okay, questions and answers in surgery. Today we discuss wound healing. Wound healing. The first question, name the phases of wound healing. What are the phases of wound healing? We have four phases of wound healing. The first phase after any wound injury is inflammation. Inflammation. Okay, this is the first phase, phase 1. Phase 2, epithelialization. Epithelialization. Okay. Phase 3, fibroplasia. And phase 4, contraction. تقلص الجرح. Contraction. إذن inflammation, epithelialization, fibroplasia, and contraction. These are the phases, 4 phases of wound healing. What is the duration of these phases? The duration for each phase. The duration of inflammation is 24 hours. 24 hours. Duration for epithelialization, it happens after 48 hours. This is within 24 hours. This is within 28 hours. Again, fibroplasia, 72 hours to 4 weeks. 72 hours to 4 weeks. And then contraction, wound contraction start more than 5 days. Start more than 5 days. Okay. What's the actions that occur in each of the following phases? What are the actions? What happen in an inflammation? نال actions. نقول الactions. What happen in an inflammation? Vasoconstriction. Okay, followed by dilatation and capillary leak. And dilation plus capillary leak ويسوي إديمة. اوكي، هاي أول يوم يصير الانفلاميشن. epithelialization, the epithelium cover the wound. Epithelium cover. هاي بالابيثيليال phase. بالفايبروبلاجيا phase, fibroblasts and accumulation of collagen, elastin, reticulin. فالاكشن هنا الفايبروبلاست. Fibroplasia increase fibroblasts and give us collagen, elastin, reticulin. Collagen, elastin, reticulin. Contraction, which happen after 5 days. What happened in the contraction? Wound contraction, myofibroblasts contract the wound. Action of myofibroblasts cause the contraction. Okay. What is the maximum contraction of wound in millimeter per day? Maximum contraction wound per day in millimeters. Okay. it's 3/4 millimeter per day. Okay. What factors inhibit wound healing? Factors that inhibit healing. First, anemia. Second, malnutrition. Third, drugs, steroids like hydrocortisone, for example, prednisolone. 4, cancer. 5, exposure to radiation. 6, hypoxia in the wound area. All these lead to inhibit wound healing. What factors prolong inflammatory phase of wound healing? احنا مو قلنا الانفلاماتوري phase هو 24 hour. What factors that prolong the inflammation? 2 factors: the presence of microbes or bacteria and the presence of foreign body. Okay. Which type of wound contracts better? Circular or square؟ يعني بالابدومن مثلا، انت بالابدومن عندك هاي الابدومن واكو incisions and wounds. Okay, just like this. This is wound. Okay, and this is, for example, circular wound. Which contract better? To clarify more, which wound contract better? Circular or square wound? More contraction happen in the square. Not square contract better. Circular less contraction. That's why we use circular incision, for example, in colostomy. Circular يعني less contraction ما يختنق ويسوي obstruction إنه. Okay. We define the following types of wounds or operations. We have 4 types of wounds or operations. The wounds, clean wound مثلا، clean wounds اللي هي الووندز نسويها انسجين معقمة، الجراح يعملها، there is no bacteria, no contamination, there is no wound in the GIT or respiratory or biliary tract. على سبيل المثال مثل الانجوينال شنو؟ الانجوينال هرنيا. زين، هاي نسميها clean operation or clean wounds. يعني شنو؟ no bacteria contamination, no bowel incision, يعني no incision through bowel or biliary or respiratory tract. Okay, this is what we call the clean wound مثل الانguinal hernia. clean contaminated النوع الثاني clean contaminated. clean contaminated wound. clean contaminated wound مثلا entry into genitourinary يعني مثلا incision through tracts GI tracts wound in GI genitourinary respiratory biliary هذا يصير clean contaminated. contaminated it means there is شنو entry into this tract plus infection or spillage. entry of GI tract and other tracts plus infection or spillage of the substance of the fluids contents. Okay, dirty wounds for dirty wounds يعني we incise through the pus through abscess مثلا. Okay, so how according to this classification of the wound, we can determine the percent of infection in such wounds. According to our classification, can determine the percent of infection in such wounds. For example, clean wounds, the rate of infection is less than 5%, while clean contaminated wounds, the rate of infection is less than 10%. In contaminated wound, the rate of infection is 15%, less than 15%, while in dirty wound, the rate of infection 25 to 40%. Okay, so according to this classification of the wound, we can determine the rate of infection. In clean wounds less than 5%, while contaminated wound أو يسميها clean contaminated is less than 10%, while contaminated wounds less than 15%. Dirty wounds should be 25 to 40%. Okay? Which vitamin can reverse the effect of steroid on the wound healing? احنا قلنا الستيرويد شو يسوي؟ الستيرويدز inhibit wound healings. Okay, what vitamin reverse this? What vitamin reverse this? Vitamin A reverse the action of steroid on the wound healing. Okay, what causes keloid? هذا سامعين به keloid. keloid ورم الخيلس يسموها. hypertrophy of collagen synthesis. keloid hypertrophy of collagen synthesis. Okay, when a keloid is excised, should the entire mass be removed? يعني هذا الwound suppose abdomen now wound وبالهيلينج صار شنو؟ صار كيلويد هايبرتروفي والهايبرتروفي راح على الإيدج of the wound. Okay, when you excise, should all this be excised? طبعا if you excise it totally again it will recur. So there should be thin circumference of keloid should be left. If you excise all, if you excise totally here, again recurrence of keloid. But if you excise, you leave a thin layer of keloid, recurrence is less. Okay, now we talk about vascular physiology. Again, it's a part of surgical physiology. نجي للفاسكولار physiology. سؤال: what is the systemic vascular resistance? Systemic vascular resistance. نستخدم معادلة أوم. معادلة أوم equation or أوم law. قانون أوم. resistance شو يساوي؟ pressure دلتا مضروب في دلتا على من؟ على المجرى الفلو دلتا بريشر على الفلو. دلتا يعني difference between، هاي الدلتا تساوي difference between blood pressure minus central venous pressure على cardiac output multiplied by 80. This is the delta. So delta pressure delta pressure by delta on the flow. Okay, blood pressure يعني مين blood pressure؟ here is cardiac output. What does abbreviation of ADRF mean or stand for? ADRF. What is this? Stand for endothelial derived relaxing factor. Okay, endothelial derived relaxing factor. What is it? What is believed? شنو هذا الاندوثيليال derived relaxing factor؟ ماذا يعتقد؟ ما هي هاي المادة؟ This is nitrous oxide. Nitrous oxide N2O. This is EDRF, endothelial derived relaxing factor. What is the effect of nitric oxide? Nitric oxide, not nitrous, nitric. What is the effect of nitric oxide? It causes vasodilatation. It is good or potent, vasodilator. Okay. What's the precursor to nitric oxide? منين يجينا nitric oxide? Nitric oxide from L-arginine, which is amino acid L-arginine يعطينا شنو nitric oxide. What is the effect of nitric oxide on platelet aggregation? It inhibits platelet aggregation. وذلك يعني ذني اللي يسوي فازو كونستركشن شو يسوي بلاتلت اجريجيشن، لكن اللي يسوي فازو دايليتيشن فازودايليتر ذس شو يسوي لنا؟ يسوي بلاتلت شنو inhibit platelet aggregation. Okay, according to the leading theories, what factors contribute to atherosclerosis? What factors that contribute to atherosclerosis? Factors contribute to the atherosclerosis. أولا intimal proliferation. So factors that contribute to atherosclerosis is intimal growth, intimal injury first, intimal injury, platelet aggregation. Growth factors, chemoattractant, intimal proliferation, and then smooth muscle proliferation. These are the factors contribute to atherosclerosis. Okay. What are the most common sites where atherosclerosis form? أكثر مكان وين يصير atherosclerosis form؟ bifurcation, carotid bifurcation, okay, carotid bifurcation. بعد arterial fixations مثل هانترز كانال. هانترز كانال هاي sartorius muscle وهذا الارتري من يدخل سب سارتوريوس هنا يصير arterial fixation. هنا أيضا common arterial fixation in Hunter's canal in arterial fixation. وين قلنا carotid bifurcation وارتريال فيكسيشن in Hunter's canal. Okay. What's Bernoulli's principle? Bernoulli's principle. قاعدة برنولي. قاعدة برنولي كلما زادت السرعة increase velocity يعني decrease شنو؟ pressure. اوكي. وحسب قاعدة برنولي يتحرك الراية العلم يتحرك في الهواء. اوكي. هنا شو يصير؟ velocity of blood flow increase at the area of stenosis. increase at the area of stenosis. بالبلد فيزل قاعدة برنولي شنو الفيلوسيتي increase at stenosis. في حين قاعدة باسكال's rule or law قانون باسكال قانون باسكال شو يقول؟ يقول resistance of tube of fluid to flow المقاومة للمجرى للفلو هذه المقاومة تتناسب مع طول التيوب. كلما زاد طول التيوب زادت مقاومة الجدار لمجرى الدم. هاي قاعدة باسكول في قانون في الأوعية الدموية. Okay. Thank you very much.